Hi, I'm Dr. Ajay Abichandani at Lee Health, and today I'm setting the record straight on some common heart health myths. That's actually a really great question. Interestingly, there have been studies performed that have shown that there are a cluster of neurons near the SA node, which also helps the heart rate and electrical conductivity. That is sometimes referred to as the little brain. That one's a false for sure. As portrayed in the movies, people have a sudden onset of gripping chest discomfort. They even portray them falling to the floor in agony. May not always present that way. So that's definitely not true. Men and women experience heart attacks in different ways. Men may have more of that classic chest tightness, shortness of breath, profuse sweating, whereas women may experience more subtle features such as fatigue, nausea, indigestion, and also vague shortness of breath. That is definitely a myth. Fun fact, in early cultures, people felt that a sneeze was evil spirits leaving the body, and that's why they said bless you. No, that's definitely not true. Dark chocolate has been studied and in modest amounts can be beneficial to heart health. Statins, however, are prescription medications to treat elevated cholesterol and bring it down. I mean, I'm not exactly a chocolate expert, but I think it's the percentage of cacao that's I don't know if you want to quote me on the differences in the chocolates, That's it's kind of partially untrue. It's weird. So there are a lot of cardiac conditions that we unfortunately can't reverse. However, there are certain conditions that can be actively managed, and in some cases, we can partially reverse the progression. So laughter is a form of medicine, I guess. It can stimulate your circulation and increase your heart rate. But generally speaking, laughter does not replace more intensive physical activity or exercise such as running or cycling or swimming. Nonetheless, you should keep laughing once a day.
Awesome.
Yeah? Good. All right.
That's a wrap. Congratulations.